Hello, my name is Diana. My topic for today is vaccines save lives. This boy has a testimony. I'm in second grade. I'd caught the measles. I spent a month in the hospital, survived, and spent a few more months recovering at home. But more than 4 million children got measles in the United States in that year and 385 died. It's time to talk. Broadcast public service ads, alert reporters, and aggressively reject the false idea of MMR. The MMR vaccine doesn't hurt kids. Imagine that all the rights to health and vaccines have been eliminated, and we must pay for any information on how to act to be protected from the millions of bacteria, viruses, or microbes that enter our body. What do you think? Probably you will say, I think each of us has faced at least once in our life some health problems. Vaccines have saved our lives and continue to be effective for the remaining generation. Or we need the vaccine to continue the fight against various viruses or infectious disease. The discovery of the vaccine was a revolution in medicine and our salvation as a nation. Throughout my career in medicine, I have seen the reduction of many causes of the disease among the population or the eradication of many diseases with vaccines' help. I have done extensive research on how vaccines have evolved and saved our lives. Here we have a graph that shows us how the vaccination of the population around the globe is gradually decreasing, which can lead to an outbreak of an infectious disease. Should we get vaccinated? Yes, because over time, vaccines have been shown to save lives, including the eradication disease. I will talk about vaccination rules, the problems we all face in terms of vaccination, the solutions to some problems, their implementation and practicability, and the actions we could take to have a healthy and well-informed population. I want to tell you a little bit about history of vaccination. The story of vaccines begins with the long history of infectious disease among the population, especially with the early use of smallpox, the material to provide immunity to that disease. Methods for growing viruses in the laboratory led to rapid discoveries and innovation, including to creation of vaccines for polio. Before vaccines are approved by the Food and Drug Administration, scientists test them extensively to ensure they are effective and safe. So, rules to the vaccination of the population. First, all medical staff is required to be vaccinated. Second, proof of vaccination of children in any educational institution is required. Third, doctors are required to submit vaccination records to the school. Fourth, each person is required to be vaccinated with the appropriate vaccine in the country they are traveling to. Fifth, states are required to provide clinics for free vaccinations to the populations. Now that we have looked at the rules to the vaccination policy, let us turn our attention to the problems. Problems with the vaccination of population. 1. Limited understanding of biological processes that underlie adverse events. Incomplete and inconsistent information from individual reports. 3. Poorly constructed research studies, not enough people enrolled for the period of time. 4. Inadequate systems to track vaccine side effects. 5. Few experimental studies were published in the medical literature. Now that we looked at the problems to the vaccination policy, let us turn our attention to the solutions. Solutions. First, publicity promoting vaccines. Second, healthcare provider recommendation to patients. Third, routine assessment of vaccination incorporated into clinical practice. Fourth, medical office staff trained to routinely assess vaccination needs of patients. Fifth, additional research seeking to determine how to accomplish the optimal vaccination coverage of targeted populations must also continue. So, now that we looked at the solutions to the vaccination policy, let us turn our attention to practicability. Practicability. 1. Revision of the rules for vaccination of the population by the authorities. Second, the physician must clearly communicate to parents and office medical staff that vaccines must be given on time and according to published guidelines. 3. Publication and promotion of information in various ways and on mandatory vaccines for children and adults. 4. Training of medical staff specialized strictly in immunizing the population. 5. Awareness of the population about the danger of various diseases in the absence of vaccination responsibility. Now that we have looked at the practicability of the vaccination policy, let us turn our attention to the actions. First, information from official sites about the risk and consequences of vaccinations. Second, awareness and observance of the vaccination schedule of the population. Third, avoiding the problematic environment and with a high risk of infection for certain disease. In conclusion, I talked about vaccination rules, the problems we all face in terms of vaccination, the solutions to some problems, the implementation and the actions we could take to have a healthy and well-informed population. Each of us has faced at least once in our life some health problems. Vaccines have saved our life and continue to be effective for the remaining generation. We need the vaccine to continue the fight against various viruses or infectious disease. It's no coincidence that 4 of the 6 letters in health are the hill. Ed Nordstrom. Thank you for watching my video.